Always Dr. Karen May, but welcome to Empower Hour Live with Dr. Karen May. I am doing this outside because it is finally absolutely gorgeous. I am trying to make certain that you can hear me because there's still lawnmowers and birds and a little bit of wind coming back. So wanted to make certain that you have an opportunity to hear me a little better without some wind in the background. I would love today to do nothing more than talk about vitamin D, and I have some pretty cool things. I want to read this first. Again, just reminding that Empower Hour Live. These are designed to be educational in nature. Oh, good, Jen, you can hear me. Thank you. These are designed to be educational in nature, so that way we can, but then also some application or action steps to take as well. And we're going to continue on our series about vitamins and immunity. Vitamin D is probably one of my most favorite vitamins to talk about, and it has for many years because there's actually so much research behind it. In fact, this morning, as I was putting everything together and final touches, I love right now my Saturday mornings and doing this because my family's all pretty quiet. And then I can't tell you the rabbit holes I go down and the research that I get to go dive into. So um, I could talk about vitamin D forever because I think it's that important. So we are going to narrow it down. We are going to stick to make certain that I'm covering what I'm supposed to and I don't take you down a rabbit hole too deep. But I want to make certain that what is the research saying, and what can we do as food as medicine, and also supplemental sources. So, hopping in here, I want to talk about the research to begin with, and I had some great, I just some great questions, and I had posted it on our Facebook. And this was taken from a blog from Dr. Mark Hyman, and I stole it, but I'm going to obviously give him credit because it was amazing. And it says, what vitamin do we need in amounts up to 25 times higher than the government recommends for us to be healthy? Again, not just free of sickness, but healthy. What vitamin D or what vitamin, well, obviously I gave it away, but what vitamin deficiency affects over half the population, is almost never diagnosed, and has been linked to many cancers, high blood pressure, heart disease, diabetes, depression, fibromyalgia, chronic muscle pain, bone loss, autoimmune diseases like multiple sclerosis? And what vitamin is almost totally absent from our food supply? And what vitamin is the hidden cause of so much suffering that is so easy to treat? One of the other research articles I was reading, obviously it's vitamin D, and one of the research articles that I was reading was that what deficiency is almost never diagnosed. And it is truly vitamin D. When I started really looking into vitamin D deficiency, it was back when I was in graduate school. Um, but we didn't think about it a ton growing up because we were always outside. We were always moving around. We were always in Michigan, summertime. Obviously, we had some great, great summers in northern Michigan. In wintertime, we didn't get a lot of sunshine. And here in Michigan, we don't get a lot of sunshine. So, looking at the research with vitamin D, I know we're in COVID world right now, but understand that when is the flu most prevalent? It's in the wintertime. It's October through March, April, depending on where you live. Flip flop that with Australia. When is it most prevalent? In their winter time, which is our summer. And so when we're looking at immunity, and we have to look at vitamin D, we have to look at what sunshine does. And so let's looking at that research, there's Cleveland Clinic had a great article, and I'm going to post their article on it too. That their article even said, hold on, let me pull it up here. Getting enough vitamin D may also play a role in helping keep you healthy by protecting against the following conditions and possibly helping to treat them: heart disease and high blood pressure, diabetes, infections and immune system disorders, falls in older people, and some types of cancers such as colon, prostate, and breast cancer, and multiple sclerosis. So, one of our big authorities here in the US that I like is Cleveland Clinic, and they're even saying that vitamin D. Now, Well, let's talk about vitamin D because vitamin D is something that is not easily gotten through our food. So I know that Jen helps me out quite a bit and is posting an infographic on vitamin D for us. It's salmon, and Lydia's out in her lawn chair. Awesome. I love it. But food wise, it's salmon and mackerel and sardines, and we get some through egg. And the only really vegan source of vitamin D is mushrooms, and it's not a high concentration. But I'm going to take my hat off. Spending, and my hairs look crazy because I had a hat on, but spending 10 to 15 minutes outside in the sunshine. Ideally, I tell people I like to do it between like 10 and 11 in the morning or after 3 to 4 o'clock in the afternoon. 10 to 15 minutes in the sun can give you between 10,000 and 25,000 IU of vitamin D. Now, we're closer to noon, sun's a little hotter. And good morning, Bev. You're outside eating your lunch, which is awesome. That sun exposure, what we're looking at is we're not talking about that you're getting burnt to a crisp. That is, it's easiest to say it's like erythema units. It's what it takes to get your skin a little bit pink, and then you can take cover. One of the rabbit holes I was going down was skin cancers and sun exposure and all of that type of stuff. And there's a little bit of conflict in the community, like the medical community and the research. So explaining to people, we're coming at that from this an immune perspective. But if you're going to be outside for long periods of time, yeah, wear a hat, loose, covered clothing, or get in the shade during the hottest and the most intense times of the sun. But if you look at some of the research, blood pressure is much lower in places like Australia than it is in the northern latitudes. And it wasn't just vitamin D numbers, it was also sun exposure. So get outside. We definitely want to get outside. But when we're looking at vitamin D from an immune perspective, it's so super protective, especially against upper respiratory infections. And with COVID in particular, there was a little bit of distension amongst the ranks within the research saying how much is necessary and before it can be too much, which was different than some of the other viruses out there. So we'll talk about that when we come to supplementation. But one of the biggest things we are seeing with COVID in particular is people that are getting more severe. It's those vitamin deficiencies, and vitamin D is one of them. And I'll put a link in there too with some of the newer. I don't want to say research because it's been the studies. They're looking at the studies of the people, but I wouldn't that like of the current cases that are out there. I wouldn't say that it's like hard cold research yet, but vitamin D levels are too low. And so if your vitamin D levels are too low, your risk of infection is higher. So getting your enough vitamin D is super important. So what does that mean and what is enough? Well, again, looking at the research, we can test. We can literally test at your doctor's office. And I'm certain I pull it up. In fact, I'll type it in the chat here. Let me see if I can copy and paste it from what I'm doing. Come on. The vitamin D, there's different types of vitamin D. There's D2 and there's D3. But if you are going to get a blood test, I put it in the chat function. That's the type of blood test you want. So when you test, there's levels. And so when I always tell people, functionally, we look at blood work differently than just clinically. What does that mean? When you get your blood test done, and it says you're within normal ranges and it gives you that clinical range off to the side, that in particular is enough. 95% of Americans fit under those ranges. So doesn't mean 95% of America is healthy. So as from a functional perspective, we look at those big clinical ranges and we narrow them down to what we think is healthy. So if those ranges, my sister, hello sister, hi Sarah. Sarah's getting vitamin D. She lives in the British Virgin Islands. But so those ranges are 50 to 80 and it's ng per nm, like nanomoles, things like that. So just know that when you're getting the testing done, they're standard units, and it's 50 to 80 is what we consider healthy. um, Traditional clinical ranges is 20 to 80 and some 100. If you're 20, 25, 30, and I have seen people with vitamin D as low as 6, in particular with someone who had pancreatic cancer, you're not going to be healthy at all. And so your doctors may prescribe to you 50,000 IU of vitamin D, and you go to your pharmacy to get it. I'm going to challenge you, if you are on that, to call your pharmacy, and you're going to find out, is that D2 or D3? Is it ergocalciferol, which is D2, or is it cholecalciferol, which is D3? All your doctor prescribes is D, vitamin D. You're getting the cheap version. And I literally had a patient sitting in my office that I had her call her pharmacy and ask, and she was dumbfounded because it wasn't raising her levels. A family friend was having the same issues. She was doing everything nutritionally. She was trying to get off of medication. Her D levels were just not raising up. It was because it was D2. So make certain when you are getting supplementation, if you need to take supplementation, you want D3. Now, also, you look at fortified foods. People will say, oh, you can get vitamin D from milk. Well, I'm not going to go there with milk on multiple reasons for health, but let's just talk about even the milk alternatives. It's D2. I just looked at my coconut milk this morning that we were putting in, that I was using this morning in my coffee. It's D2. It's not D3. And that's because, so I actually previously I had called, we also use flax milk, and I had called the company, I forget, Karma, I think it was Karma, and there was also Flax Milk USA. I asked why they didn't use D3. And the reason they don't use D3 is because the best source of D3 to use in supplementation comes from lanolin. Lanolin is off of sheep's wool, not killing the sheep, but using the lanolin off their sheep's wool. So they can't do that in order for people who are vegan or have sensitivities. So they always use D2. Now, you can get D3 from a vegan source, and it's mushrooms. And one of the supplements I particularly use with my patients who have neuropathy is we're trying to increase nitric oxide, and we do use a mushroom-based D3. And it's just not easy to get. It's hard to process at times. So it's just can't eat mushrooms and get enough vitamin D. So what's a person to do? Well, if you live anywhere in Michigan, but if you live north of the equator, the farther you go away from the equator, more vitamin D you're going to have to get because you're not going to be exposed to it. If you are African American or have a darker skin tone, that is a protective mechanism built in to help so you don't burn. But the problem is you're also not getting as much vitamin D either. So you may find that you're also deficient. And then take our society of we're inside all the time, even on good days. So it is getting some sun exposure. It is getting outside, and I'm sitting here. My T-shirt, it's a bit of a V-neck. I have my arms exposed. If I've already been out here, so I have my hat on. 15 minutes of sun. Get outside. Get that. Then it's doing some supplementation. So when we look at the supplementation numbers, we can go, again, doctors are all over the place with this. So I'm going to do a conservative number right now based upon some of the research I'm seeing, especially with COVID, about 2,000 IU a day. That's the max level that the government, and that's the RDA, they're telling you. But I can tell you from a functional perspective, we have safely used, based upon their blood work, we've safely used numbers in the 5 to 10,000 a day, especially if you have an autoimmune disorder. We've used 50,000 a couple times a week. We've used 50,000 once a day for a week, and then once a week because someone was so deficient. Just know that if you are that deficient in vitamin D, it takes about 6 months to fill that tank up. So 2,000 IU right now. You probably got to supplement by just getting outside 3 to 4 times a week and getting some sunshine. Foods, salmon, mackerel, sardines. I can safely say that I probably eat salmon. I'm not necessarily a big sardine fan, and I can't necessarily say I've ever had mackerel. Eggs periodically, but there's not enough in that in order to boost your immune system. So, a little bit of supplements. I'll put it in there. I'll put the ones I recommend in there. And also sunshine. Get out, be active. And it's also getting outside and getting vitamin D from sunshine is also more protective cardiovascularly and other diseases than just the supplements. So, keeping it simple today. We're almost at the 15-minute mark. Really no recipes to post. So my recipe for today, especially if you're in Michigan, you can see the beautiful clouds behind me and blue sky. Get outside, get some sunshine, and enjoy putting your feet in the grass too. It's been awesome. So I am going to take any questions that you do have, and know that vitamin deficiencies in general will absolutely create a lowered immunity. So follow our previous videos to make that happen. Also know that there's really no big food sources that you can truly get through your vitamin D. It's just not easy. So supplementation is necessary, whether you're getting outside and getting some sunshine or you're using vitamin D3. You can check where your vitamin D levels are at very easily, and that's by a blood test within your doctor, and I posted it in the comment section here. And I'm not seeing any questions coming around. Know that I am doing a neuropathy seminar on Tuesday night, and so if you're interested, it's at 5:55. You can always take a look at our events page here, and I would love to see you there. Any questions, any comments, anything that I can answer for anybody? I don't think so. So I want to say goodbye to Lydia. Oh, hold on, Lydia's coming through. Yeah, what do you suggest for people, Michigan people? I'm one of those Michigan people. Yes, it's supplementation. I'm not a big sun tanner, like artificially, and there's some benefits and things like that. But yeah, it is supplementation. And then when the sun isn't out, it's supplementation. But don't forget, 3 to 4 times a week, even 3 times a week, 15 minutes. First thing in the morning will get you 10 to 25,000 IU of vitamin D in about 15-20 minutes. So it's not every day that you have to get that, Lydia. And the rest you can do some supplementation. Any other good questions? I don't think so. No one's popping them in there. Feel free to keep them in the chat box, and we'll answer them as they come up. But I just wanted to say goodbye to my lovely sister. I do miss you and hope to see you when we can see you. And know that if you have any more questions, just go ahead and post them. Thank you very much and have a great rest of your day.